with
Yeah.
that impassioned speech
Oh,
there.
I've been trying for years, and I got fed up with, I shouldn't say it, Somerset Bus Partnership, because they only dealt with people who had buses and times of buses and things like that. But we don't have any, and we're the main commuter link, apart from the main road, between Taunton and Bridgewater. And when I came to live here, there was transport, and now there's nothing. And the one good thing that happened, my husband, I'm carer for, they found a melanoma for him on his skin, and they were insisting we went to Exeter. And I can't drive these long distances at 81 or nearly. And at last, because he's got a form of cancer, although it's only A1 and not to worry about. He suddenly gets hospital transport and all these things that are out there and you don't know about. And I thought you would be the perfect people to be able to help in such situations.
Well, hopefully we'll give you some information today that you can definitely take away and use, Amanda. I'm going to go to Andrew Flower. Could you please just introduce yourself and mention something that you thought was particularly compelling about some information you heard about health and wellbeing and why, please?
Hello, good morning, everybody. Thank you very much indeed. My name's Andrew Flower. I am the chair of Muchenley Parish meetings. We have no parish council. We are just a parish, and we have 2 meetings a year, as we're a very rural village on the Somerset Levels and Moors. And basically the health and wellbeing raised some very good issues when we're part of the Levels and Moors LCN, and I attend their meetings online and at venues that are made available. And yesterday I was online with the presentation that Photo done, which was absolutely fantastic, and it raised a lot of good points about community council, charities, community council and health and wellbeing, because we have such a senior age group in the village. They, without any transport, they make great use of the Slinky bus to get to Langport and other locations, to join up actually with the 54 bus route that comes from Taunton through to Yeovil to try and get to any appointments. So that is fantastic. But the main reason is the health and well-being of our very, very senior citizens who have mobility issues, and also because of the flooding, which one of the roads is, quite regularly shut off, that takes us to Langport, is the isolation part of it for our very senior residents, who some of them actually live on their own. So we just want to try and get some real benefits from the health and well-being, to try and assist our senior citizens about not being left behind or left out. So the health and well-being has been very good for us to try and build a picture up about what we need to do for our residents at Muchenley Parish. Thank you.
Great, thanks. And hopefully you'll have a message that's popped up on your screen that says that Karen's just started to record this session. We would hope to share this session with a wider audience afterwards so that they can hopefully benefit from some of our conversations today. But please contact me or contact the team, Karen and Photo, and if there's any problems with that. But my email's in the slide deck, so please feel free to contact me, not only about the recording, but if you want to get in contact more laterally and discuss any ideas, that's great too. So next we have Anne Hills, who I think Anne's another one of our returners, aren't you, Anne?
I am indeed. I liked it so much I've come back. Yeah, Anne Hills. I'm a town councillor in Frome, and the health and wellbeing information I saw recently was just this week, and it was that for women, just 3 minutes of activity, exertion, I think was the word they used, per day halves our chances of a heart attack. And the reason I found that interesting, I'm a woman of a certain age, and it's how little you need to do to improve your health. So tiny changes can really improve your health.
Great, thank you. And next, Bill Hobson. Could we just introduce yourself, Bill, please?
Yes, good morning, everybody. Bill Hodson, I'm a town councillor for Minehead, and recent, as it were, councillor. A couple of years ago, I was, how can I put it? I was stitched up to do a project regarding a swimming pool. Regarding animals, I have a cat, and the cat hates me, so I think that encourages me to get out of the house.
Right.
So that's part of my exercise regime, is avoiding the claws. Regarding this project that I've been on for quite a while, which is to arrange, fund, and so on and so forth, a swimming pool in Minehead. Minehead is obviously about 12,000 people, and we're part of West Somerset, which is about 27,000 people. And it seems a bit odd that a coastal town such as Minehead doesn't in fact have a swimming pool. Other towns obviously do. And we've entered this program of trying to develop a case for funding for a swimming pool. And so I was invited, not quite certain by who, to join this group to see if is there some advice that you all collectively or individually can provide regarding that project. I'm pretty sure that swimming is a good activity. We haven't stopped there. We're calling it a multi-activity centre, where we're trying to go to towns and villages around about 8 miles or so from Minehead to incorporate what they're already doing for I don't know, walking, horse riding, archery. I'm open to anything that would actually get people moving, which I understand is a pretty important part of health and well-being at the individual level. So that's it. That's my input.
Thank you. And if we could go next to Denise. I haven't got your last name, Denise, unfortunately. So hopefully you'll be able to join and just introduce yourself. You're currently on mute. I don't know if you're not able to join us, or whether you're just on mute. Okay, we'll go on to Emily then. Emily Osler, another returnee, I think.
Hello. Hi, morning, everyone. Yeah, my name's Emily. I'm a Community Engagement Officer at Frome Town Council. And yes, I am back for a second time. A really good webinar last time. Okay, so what have I got to say? Nothing official as such, I suppose. Just thinking about my own experience. I just find it so helpful when things are getting stressful to just get out of the four walls and go outside, and being outside in nature and connecting with nature, showing to lower stress, lower blood pressure, lower heart rate, and increased mood. So that's a really big one for me.
And I take it you've probably seen some really compelling information as well that kind of reaffirms that case to get out and about, Emily.
Yeah, absolutely. And actually recently, just this week, I was reading a grant application that was talking about the idea of social connection, but it was also talking about connection to nature and to things, and kind of how important that is for health and well-being. So yeah, all links up. Thank you.
Thank you. And next week, could we go to Glenn Gapper, please?
Good morning. My name's Glenn Gapper. I'm a parish councillor, and I had the pleasure of meeting Fodo at a recent LCN meeting, where I was introduced for the first time to these health and well-being exercises that are going on. I previously wasn't aware of them, but it coincided with a growing concern that I have regarding the acoustics of village halls and facilities. Apologies for that.
No.
Talking about acoustics, it's on rather a loud volume because I myself suffer from hard of hearing. But I've got a growing concern about the acoustics of village halls and meeting facilities and the potential impact upon the disenfranchised,
Yeah.
excluding people with hearing difficulties, which of course necessarily means a fairly significant proportion of the elderly population from democratic processes, particularly local democratic processes. So that's the thing that I'm primarily concerned with at the moment, which is why I'm here today.
And next, just move my cursor a bit. So Helen Astill, could go to you, please. Don't know if you can hear us, Helen, or whether you're on mute. I think you are on mute. I can see you in the bottom of our screen. No? Okay. Jeff Brown, could we move to you, please?
Morning, everyone. Jeff Brown. I'm in the partnerships team at Somerset Council, and I've been involved in the South Health and Wellbeing programme right from the start, along with Alice and Frederick. So yeah, keen interest in what's going on, and I'm going to partially steal Alice's getting out with the dog reason and positive impact on health. Having recently got a dog, just turned one, Mad Spaniel, our local pub reopens tonight and it is dog friendly. So possibly not completely on the health message going to the pub, but it's a walk I'm looking forward to this evening and some socialisation with people that I haven't seen since the pub closed in the spring.
Well, there is a lot of research that's been done by another university on the importance of connectivity and mental health. So I think you've got an evidence base to support your trip to the pub tonight there, if you wanted to use that.
Very kind of you to say so. Thank you.
Julia Borland, could you please introduce yourself?
Hello, I'm a parish councillor in West Crooken, which is rural. There's about 4 really rural hamlets. The biggest thing I would like to see, and I've been to one of Fodo's meetings, one of the LCN meetings, is to actually encourage more people to come and just talk, especially when somebody's been bereaved. They are so isolated and probably for years have been carer or whatever. And they just need to start living their lives again. So if we can do anything towards that, it really does improve everybody's well-being, and that's the whole community, because nobody is left and pushed to one side. So that's what I'd like to think. And
Julia, has that been something that you've also read, something that you've seen in documents or news that's backed that up as well?
Not specifically, but I just know from my next door neighbour who had hardly been anywhere in the area for the 23 years that she lived with her husband. But when he died, it was all new to her. And it was quite sad to think that even living that close, I didn't realise she knew nowhere. Okay. So that's my personal connection.
Thank you. And Laura Miller, could you please just take your turn and introduce yourself, please? No? I think most people are on mute, but we'll move on. Lucinda Spellman.
Hello, can you hear me?
Yeah.
Oh, hello. Well, I'm a town councillor at North Petherton Town Council, and I also run a charity to get a community hub built. It's for an area called Wilstock and Stockmore. We are rather sort of out on an arm. We're between North Petherton and Bridgewater, but we come under the parish of North Petherton. It's sort of new build area, and we've got 5,000 people living down here, but we don't have any facilities of any kind. So that's what our charity is trying to do, is to build a community hub. We're trying to fund it, and it is a community-led project, but of course there's no social connection here whatsoever, and there's a lot of isolation and loneliness, actually of all ages, because we've done an extensive amount of community consultation, and even the youngsters feel lonely, and we want to promote well-being, you know, to give everyone a better way of life, really. So it's interesting to hear what everyone has to say.
And Lucinda, I suppose some of that that project would involve kind of collecting insights off people as well.
Yes, yes.
So next, Paul Brady, can you introduce yourself, please?
Yeah, it's Bradley, not Brady.
Bradley, I do apologise. Sorry.
I'm past chairman of Misterton Parish Council down in South Somerset. I've stood down and I'm now still on the council and on several of the working groups. We are trying to get our village back to the sort of lively village it was pre-COVID. We are succeeding in part. We've got our village hall, which is now starting to get more and more activities. We have a couple of cafes in the village, but we also suffer from being on the A356. And one of the worries I have is the health problems of having enormous HGVs down a narrow country village road with several bends and with cottages built straight on the road itself. And we want to try and find out what can be done to help the health of all the people who are latest information are undoubtedly suffering.
Yeah. So you're already gathering that information and building that case, I take it, Paul?
We're building the case of the transport at the moment, but we have yet to find out how we get the sensors to help us recognize what is happening. We haven't had a lot of enthusiastic support from those we've asked so far.
Okay. And could we move on to Pauline McNichol, please?
Yeah, hello. I'm on Wiveliscombe Town Council. It's a smallish town, about 3,000 population, about 12 miles away from Taunton. And Photo's also on the town council, and it's been leading a lot of the work around the very small but perfectly formed health and wellbeing group. So we've carried out surveys recently as part of our community plan, and one aspect of that was health and wellbeing. So some of the questions around physical activity that people would like to be involved with, but also social connectivity and stuff. So for me, I think the evidence, in terms of interesting evidence. So before I moved back to Somerset about 10 years ago, I lived in and around Manchester, and there was a whole tranche of work going on around social connectivity, particularly men in sheds, which was really big up there, and also social prescriptions. So I think for me, I've got a bit of a question really about the type of evidence that we're collecting. So earlier on, people were talking about raises in cortisol levels or effects on type 2 diabetes and reduction in heart attacks and things like that. But how do we measure things that are more, I don't want to use the word anecdotal, but things that aren't, rises in this, and how do we measure the potentially unmeasurable? So are we relying on interviews and things? That's what we did up in around Manchester for the men in sheds work and the sort of social prescriptions. But then is there a sort of a hierarchy where the measurable things that's the best thing you go for?
Sorry. I think hopefully we'll unpick some of that question today. I know Mark's got a few slides lined up later where we're going to talk about a project that we're involved in East Sussex, looking at people who are at risk of homelessness and also presenting as homeless, and how we collected evidence for a project that used wellbeing coordinators to kind of tackle that, and we used different kind of information for that project, but that's probably for a little later on. Philip, Sharat. Could you? Don't know if Philip's still with us. Oh yes.
Yeah, I'm just coming off mute. System's a little bit slow. Phil Sharrett, Ala Parosh Council near Langport. I actually run a social enterprise as my day job, helping people who've lost control of their gardens because of age, ability or circumstances reclaim their outdoor space so they can enjoy the benefits of being outdoors with nature in the safety and security of their own homes. But living in Ala, I've been put together a group of people from parish councils and churches around Somerset who have an association with King Alfred, and we're looking to establish a pilgrimage to get people walking and cycling. And working with Langport Council, we've recently submitted an application or an expression of interest, rather, to improve active travel routes coming out of Bridgewater into Somerset. So people that are urbanised and may not get out into Somerset as often as they might, will have healthy options to be able to come and visit historical sites at Western Zoyland and Athelney and Ala and other places around Somerset.
So lots of information gathering there, I take it, Phil.
Yeah.
Great. I think we've managed to do round the room.
Seymour, no, the bottom of the list.
Seymour, okay, yeah.
Who is Seymour?
So where are we?
Robin.
Robin Leverage. Could you just introduce yourself, please?
Hi, I'm Robin Leverage, Chairman of Lymsham Parish Council. One of the other things I do is I'm trying to lead the reordering, the posh word for putting a loo and water and a kitchen area in our local church. It's taken us 10 years to get the diocese to give permission. We've got the plans drawn up. We know how much it's all going to cost. The only trouble is we've got to find the money to do it. So I'm just about to start gathering evidence, and I'm rather unsure about how to do it.
Well, hopefully you'll get some tips today then, Robin, sorry. Can we go to Rosa Kell next, please?
Yes, hi, good morning. Can you hear me okay?
Yep.
I've got a sore throat today, so I apologise if I go croaky. I live in Wales. I'm partial disabled, and when I found myself unable to drive, I was horrified at how little transport there was for me to get anywhere. Obviously, I then got depressed and all the usual things that go with it, and it took me about 5 years to get out of it. I have learned that by volunteering to help others, I'm actually helping myself. I am now a bus campaigner for rural transport, for buses generally within Somerset, and my special interests are old, younger and disabled people of all disabilities. What I have found interesting here so far is how many people I agree with. 3-minute hug is wonderful, but if you live on your own and you've got no one to share a hug with, it's very difficult to go out. Sometimes even touching someone's hand at a supermarket or whatever, it feels like a wonderful thing to have happened during the day. There are many, many people in rural Somerset, and we are a very, very rural county that needed that kind of connection, and that's what I'm about.
Good.
Thank you.
And Simon Bellamy.
Hello, Simon Bellamy. Can you hear me?
Yes, yes, we can hear you.
Okay. I'm very in a similar boat to many of the village councillors. Actually, I'm a village councillor myself, and I was at a wonderful meeting that Fodo did for us at the LCM. So thank you very much, Fodo. You're very talented at that, very good, and conveyed the message well. And the message was about well-being and mental health in our communities. And I reported back to our council, and which is only small anyway, you know, Vicar of Dibley kind of stuff. And we were acutely aware of the fact that we didn't know what the need was in our village. One person knew of a couple who were in the same boat as many of you have already said, so that hence the similarity, and there's a common trend here is transport, loneliness, and how to get your shopping and things like that. So we're trying to identify the need. Is there a need here? What is the need for us to be able to do something about it? Because in the parish council, you don't have to do anything yourself. You can just connect people up, perhaps, you know. So we tried to find out what the need was. So we kind of thought that a village agent, I don't know if any of you are familiar with village agents, might be able to help them. Somebody who knows. So who do we ask to know without doing an intensive poll in the village? So I contact village agents, and they put me in touch with a chap called Mark Shields from Somerset Council, I think. Anyway, I've got a meeting with him, oddly enough, this afternoon at 4 to discuss what we're looking for, and we're really trying to fact find what the need is in our village, and then we can put together a sort of facts and compelling evidence. That's it, evidence about what we need to be able to get a grant. But also we're acutely aware also that if there isn't a need, then there is a do nothing option. But I think there probably is. It is a small village, but yeah, that's where we are, trying to find out stuff. And so it's really good to be in the same boat as a lot of the village and town councillors trying to address all the same issues. We're all together on this, so I'm really happy to be here. Thank you very much.
Thank you. Teresa James.
That'll be me. So hello, it's my first time coming. I'm a parish councillor for Mere. For anyone that doesn't know, Mere is a very small little parish. We have no transport. We have a bus twice a day, but not at weekends. We have no facility where anybody can just go and grab a cup of coffee or anything like that that's really reachable. We do have a pub that has just reopened in West Hay, but it's not walkable, especially not for the elderly community in our parish. 7 years ago, I felt that there was a need because there was no social interaction. So I set up a not-for-profit company, and we have successfully, thankfully, now run quite a lot of events in the village, but we only have a very small church room that we can use as a facility. So we run, we do a monthly breakfast, we do bingo nights, we did a very successful casino night this year, and we've done a lot of things like that, but they are all on the social side, and it has brought a lot of people together. And we had a karaoke night in October, and we had people in their 90s coming to it, as well as family with young children. And it was lovely to see such a wide spectrum, and they all thoroughly enjoyed it. But like I say, it's not for profit, so all the money we do raise, we put back into the community, and we ask the community what they would like. So we got a lot of teenagers together earlier in the year, and they've got nothing in the village at all. The younger children have got a park, but the teenagers have got nothing. And all the teenagers, we did a little event for them. We did a graffiti painting event, not anywhere in the street. They were given art boards to do it on. And they all said that they would like an outside multi-gym. We were like, oh, okay. There was a bit of space in the small children's park. So we went on a big old fundraising thing, all of our events, and everybody was up for it. The teenagers helped. We did a couple of car washes, we did a couple of boot fairs, and we got the money together. And then we basically bought 5 pieces of equipment that went into the park that is aimed at adults and teenagers. It's got things that the elderly can use as well. So it's got the walkers. So we've had a couple of the 80-plus-year-old ladies on them when their grandchildren are in the park. But to do that, I mean, we had to raise £12,000 to do that. So it's a lot of money, but it has been really successful. But I still think there is a need more for transport. They can't get out. Nobody can get out of the village. If at the weekend you want to go anywhere, you can't. And that is a concern. You know, I mean, a lot of my team of volunteers, the elderly that come to our events, they know that they could call any of my team and say, oh gosh, I've got a prescription that needs picking up, would you go and get it? But we've had to put that in place. And I'm going to say, even as a councillor myself, we don't always have the backing and support of the parish council. So that's how difficult it is in Mere.
I found it really interesting, particularly about the graffiti event, Teresa. So I think you're already using creative research methods.
Absolutely. It was brilliant. It was absolutely brilliant. And in fact, some of the big graffiti boards that a couple of the young boys did, we've now got up on the wall in our church rooms. And the elderly that have seen them, they're like, oh, they're great. And it's lovely. So, you know, we've got both ends of the spectrum supporting each other in that way. The guy that came and did it was brilliant. We've got a car park. We filled it with plastic sheeting, and he showed the children how they should do it. But teenagers being teenagers, they did their own thing, realised that didn't work because all the paint ran everywhere. So then they repainted their board and started all again. And I mean, I wish I had a couple of the bits to show you. I mean, they were amazing. One young boy of 15, I think he is, he did a graffiti thing of the tour in Glastonbury, and it was absolutely amazing. And that is up on our wall. And it was lovely. It was really, really a nice event.
We'd love to see some pictures, Teresa, if you want to send them.
Yeah, I will. I will.
Yeah.
In fact, I'm going down there in a minute. We've got a Christmas wreath workshop tomorrow. So I'm going down to the car park today to go and cut a load of bits of bushes so that we can do it. So I'll take some pictures of the ones on the wall and I'll send you them. They're absolutely amazing.
Thank you.
Right.
You do it on them white walls there in that room.
Yeah,
exactly. We're a bit plain, aren't we, down here in Lincoln? Yeah. Could we just move on to Vicky Bryce, please?
Sorry, can I just interject really quickly?
Yeah.
Teresa, I put it in the chat, but I'm wondering if you're involved in Avalon and Bolden's LCN Health and Wellbeing Working Group.
I'm not.
Okay, just check the chat. Sorry, we need to move on because we're a long way into this meeting, but get in touch with me afterwards and we'll connect up.
Brilliant. Excellent.
Okay, and I think we're going to go to Vicky Bryce.
Yeah. Hi. Yeah, I'm the town clerk for Axbridge Town Council, which is next to Cheddar. So we're a town, but very small. We've only got sort of 2,000 or so residents. And I also volunteer and set up a small social group for over 50s, which meets fortnightly. Only has about 15 regular attendees, but that is a nice tangible benefit to people's well-being. I enjoy doing that. I think the first question was any health news that came up recently, and I did see a lady being interviewed. She's a reporter on binge drinking on the BBC, and that was really interesting. And I then watched her documentary. And it was interesting because the definition of binge is a lot lower than you would probably anticipate. So
Thank you. And I think now I can say we're at the end of the list, can we, Mark? And we've just got Will Rowe. I don't know if you can hear us, Will.
Hello, everyone. Yeah, I'm Will Rowe. I'm the grants officer for Taunton Town Council. And yeah, in terms of a piece of information, I just find the sheer scale and what health and wellbeing kind of encapsulates, really. It can be anything from social prescribing right down through just to ensuring that you get enough or drink enough water or get enough sunlight in your day. So I just think the scale is what I find interesting, and how much health and wellbeing actually encapsulates and how many people that can help out.
Thank you.
Yeah.
So I'm going to go back to my slide deck, hopefully, if Teams is going to play ball still. Let's have a look. Yeah, there we go. So thanks everyone for those insights. Let me just get there. So what we kind of had there is quite a wide and quite varied set of information about health and well-being. Some of it probably through personal experience, some of it from bits of research that you may have read, news articles, and some of it about preparing grant bids. Today we're hoping to cover quite a few think points, which is what I've termed them. So we've talked about some of the issues in your community, and there's definitely some themes that I think have come out there on connectivity and linking up, as well as other stuff about being active. But today the key think points are what grants are available so you can use this training, and hopefully support some of the ideas that you've also discussed in the previous kind of 45 minutes. We're also going to look a bit about thinking about what types of information you might be able to use to support gaining a grant, but also monitoring progress of a grant as well, particularly if you are in charge of issuing that grant. And also ways in which you can collect information, or what scientists might call data. Often data is something that comes before information. Information is the bit that makes sense of it all, hopefully. And then we're going to think about how you can do this, when and why, and how you can support grant applications using these information sources. So I'll just move on briefly to my other slide, hopefully. So today's overview of today's session is why do we use evidence and data and information? And we've kind of touched upon that quite a lot, I think, in our previous discussion. Also, we'll be introducing different types of evidence or information, the sources that we can get these from, and also how we can collect them. And we'll hopefully touch upon planning a project and planning an evaluation, and some of the activities that you can do, and how we can kind of formally call these activities basically methodologies or methods of research. And then we're going to talk a bit about arranging and structuring evidence in preparation for a grant application, and Fodo's going to kindly just refresh us all on the health and wellbeing grant programme. And then we're going to look at 3 scenarios from your own part of the world, from Somerset. So we're going to use 3 scenarios, and then kind of hopefully have a bit of a group discussion about some of the information and some of the learning that we can apply to your part of the county, with 3 projects that look at youth. So we'll be discussing, for instance, seed grants, very small grants that you might want to use to kind of develop an idea, smaller grants, and then larger grants. And then also finally, just basically how you think we can help you going forwards to kind of help put some of these ideas together. And we're all hopefully going to be joining you in Somerset in the new year to do some in-person events, and we can hopefully cover that. I think we've got someone with their hand up. Is it Teresa?
Yes.
Teresa, would you like to just join?
I just wanted to ask, are these slides going to be shared with us?
Yeah. The slide deck will be shared.
Writing it down.
That's fine. The slide decks will be shared. And what I've done at the back of the slide deck, because we've not got time to cover all the resources, I put a list of resources and YouTube video and some tools that you can use to plan a project out on a page and hopefully break things down. So hopefully some of those resources will be useful to people. So yeah, how can we help going forwards? Well, hopefully my screen will go.
We will have a break too, won't we?
We will, sorry, yes. Mark's just reminded me we will have a break before, in the middle of this. So yeah, please don't worry. But as I said before, if you need to just move away from the screen or go and get a drink, please do that. That's completely fine. So why do we use evidence? Well, we make a case for something, and this can be a case for new or ongoing funding from the Community Health and Wellbeing Project or an activity or a service. We sometimes use evidence or information to shine a light on an issue and problem. My colleagues here at the Institute of Rural and Coastal Health particularly share a common thought about the inequalities of rural and coastal populations in accessing health services, but also research. And to show also why an idea or an existing project, service or activity is needed or not, to avoid duplication. So to evidence what's out there and what can be done that's unique, basically. But to also provide a case for funding project, services or activities. So sometimes we have a good idea, but we just need to think about how we can evidence that idea and develop it into something more substantial. And we also do research and collect evidence to improve real world settings, so modify how a service is delivered. And also we use research and evidence to show if a project, to treatment and activity is working, how, when and why. And we have a few examples on this page next of some of these how, when and why issues. So you'll probably see on the top left of your screen a group of youngsters in an American prison. But during the 1970s, this was called the nothing works era in terms of reducing reoffending. So prisoners in America developed the idea of scared straight, which was where youngsters who were deemed to be quite risky and at risk of going down the same path were introduced to the prison settings, and the inmates who would literally try their best to scare the proverbial out of these young people so that they wouldn't go into the lifestyle that they had chosen or being forced into. So to try and reduce reoffending. And what actually happened is when the evidence of the 70s Scared Straight programme was gathered, it was actually found that it wasn't not only ineffective, but there was also evidence of reoffending from the people who had taken part in that programme. And we also look at things around unintended consequences of some of the interventions. So, for instance, we sometimes establish an intervention, and if you see the example of Viagra there, which is hopefully quite well known, that Viagra originally had an active ingredient that was targeted at heart disorders, cardiovascular problems, but actually had rather different side effects, which an evidence base was needed to be built upon to prove if it actually was useful for erectile dysfunction, for example. And something that we're all probably overly familiar with now is the role of clinical trials and testing out and improving the evidence on effective vaccinations, in this case COVID-19, but also you could apply that to other vaccinations. And this section is, as I mentioned earlier, about a project that myself and Mark, along with colleagues from Loughborough and Nottingham universities, have worked on. And would you like to?
Yeah, thanks, Hayden. So I just wanted to pick up on Simon Bellamy's term that he used in when he was talking. He used the term compelling evidence, which is an interesting term, and I think it's a useful one because when we're looking at evidence and data to support a particular case or an idea, we can look at evidence or data. Some of it's quite dull and can be dismissed quite easily as so what. And so I think what Simon is looking for is something that really is compelling, sort of hits people between the eyes and builds a case that leads to the conversation, well, this really needs to be done. This is really important. There is, we need to do something about that. As a scientist, though, it's very important for myself in my professional community to be objective and measured. So how do we strike a balance between presenting a compelling case for a really important thing that requires resourcing, but not drifting off into a poorly evidenced but quite emotive type of case? So it's about selecting data that supports the case, but is also compelling. So it says things to people that people understand, particularly decision makers, but also the people who are involved in the particular situation. So how do we do that? Well, one of the ways to do it is to have a balance of data between what we call qualitative and quantitative. And to remember, qualitative is is not numbers. It's anything but numbers or statistics. So it's what people say, what is observed in an interaction or an encounter in a service, for example. That wonderful graffiti that we heard about before, that could be an expression of a young person or even an old person's, an expression of their feelings or what message they want to convey. So in qualitative research, which is something that we do a lot of at the Institute here, we look at those types of data or information, or we like to also call it wisdom, that people have that we can then collect in a systematic way and then present that as part of the compelling case. The quantitative data is what most people are probably seeing all around them, and that's to do with numbers. So hence quantity. So that's how you remember the difference. Quantitative is quantity, about numbers. Qualitative is about quality or depth of understanding. And if you use both of them effectively, you can build that really compelling case. So we were doing some work in another county in the southeast, and we were looking at this issue around a service for people who are homeless or at risk of homeless. And this was quite an interesting and innovative service. And the decision makers and the funders were wanting to know, is this service of value? Should we continue to support it? And that's a very good question, because money is short and money should only be spent on those things that we know or that we think we know are beneficial. So this is some of the data that we collected in a qualitative way from those stakeholders, service users, and people that were working in the service. And you can see a service user there has said that, and I can't actually see the quote now because I've got people's faces in front of it, but that's all right. But you can read that and see that the service was useful in terms of its acceptability to the service user. It was something that they were able to engage in easily and effectively, that meant they were then able to open up about what their needs were in terms of their homeless experiences. But we also balanced that, and we didn't just ask one service user, we asked multiple service users, but we also used a similar approach with the people who worked in the service, so the wellbeing coordinators. And there you can see that they have said that the value for them was being able to make a decision on a priority of the issues, break it down, work through it, and then the service itself could then determine what the highest priorities were. And that was something quite different for that wellbeing coordinator who'd worked in a very structured and dictated service in housing in the past. We also asked stakeholders, so people who weren't service users but had an interest in the service, and together or collectively, we were able to then present the positive value beyond the quantitative or numbers type information that we're already collecting. So this is really compelling and makes sense to people, whether they're decision makers or service users or regular residents. This type of data makes sense to them and is quite compelling. So the second type of data on the next slide is quantitative data. And this is data from the same service that we were evaluating. And we had a huge amount of quantitative data that we might have had access to. But this is just one of them. And when people were identified as needing a referral to this new service, the referring person had to indicate what the criteria for the referral was. So was the client having issues with alcohol and drug dependency, which then made them more vulnerable in terms of housing security? Did they have a physical disability, a mental illness? Were they caught up in domestic violence or abuse, etc.? And this was designed to give us a sense of what types of issues were presenting for people that made them eligible, I guess, or appropriate for the service referral. So this is numbers, and we can break it down into proportions of referrals and their main reason for referral. And some people really like this quantitative data because the numbers appear to be objective and without emotion. And we find that some decision makers, particularly politicians, people who hold the public purse strings, they like these very simple numbers because they're not challenging and they're relatively, again, compelling. However, there's a problem with this data, and that's the top category, which was other. So the referrers were more likely to just tick other than they were to select one of the predetermined categories on the form. And what that means is we don't know what other is, but you can see it's the largest proportion of referrals. And this indicates perhaps a problem with the way we design the data collection tool, or the service designed the data collection tool. So the service determined what these particular categories should be, and then that was used by the referrers. But you can see that it's not quite as useful as perhaps it was intended to be. And therefore, perhaps our suggestion to the service would be, you need to do some qualitative research to determine what are the issues that are leading people to be vulnerable to housing, and then use those in the quantitative data collection. So using both types of data, numbers, but also qualitative experiences, is more likely to produce a useful and compelling case. So that's quantitative versus qualitative, and both of those types of data are valuable and they should be valued equally. Sometimes they're not. Sometimes it's the numbers that get, presented as being the most important. But there's also primary data. So if you're looking for data to support a program or an intervention in your place, you can look around for primary or secondary data that you can then use to help build that compelling case. And the primary or secondary data could be qualitative or it could be quantitative. But what primary means is essentially the stuff that you collect, or a researcher will collect, or an interviewer will collect. So it's information that you have generated. It might be asking people at the village hall for their views on a particular thing. It might be doing a survey. It might be counting the numbers of people who go into a particular activity. That's the data that is considered primary. And you can see we've put some activities in there that can be used to collect this type of data. And primary data is really useful because it sometimes picks up information that is outside traditional data collection that goes on, like a census or something like that. So think about the primary data that you might be able to use or collect to make your case, but also to evaluate potentially your intervention. So you could have conversations with people that are semi-structured. So you have a similar conversation with a number of people, and then you can pick up common themes that come out of those conversations. You can watch, and watching is a really good way to collect primary data. So what happens when this occurs? What do people do when we offer this? Those sorts of things. What happens when we move a particular signage on a busy intersection? Those sorts of things. And then there's secondary data. And secondary data is data that other people have collected, but that you can use, you can access, and then use that yourself to again build the case or to measure outcomes. So you can look at existing publications that talk about the issue that you're interested in, how big it is, what sort of impact it has. You can look at grey literature. That's the term that we use to categorize stuff that's not in scientific or peer-reviewed publications, but is out there. So it could be reports from organisations or groups. You can look at census data. That's always useful, and I know that Alice Munro and her team and Photo more closer to you are looking at ways that information regarding local area can be made available to you. And you can also look at issues in existing evidence. So what's in the paper, what's in the news, what is government policy thinking about? And some of the things some of the methods you can use are looking at literature, researching archives, secondary qualitative and quantitative analysis. So you can take the data and you can manipulate it yourself to do what's called a secondary analysis. So we've got qualitative, quantitative, but we've also got stuff that you generate and then stuff that's already available that you can draw on. So thinking across those types of data, if you think across them all rather than focus on one, that can build a more compelling case and be more useful to you. Next, thanks. Okay, so I think we've talked a lot, and we've got to know each other as well. And after the break, we're going to do some practical stuff around applying some of what we've just talked about. So we've got 10 minutes to have a comfort break, grab a cup of tea, but think about those types of data that we've just talked about, and what it might be that you're thinking about in relation to the issue that you're interested in, that we heard you talk about earlier on. What types of data might be useful? Is it qualitative? What types of quantitative data might we have? And after the break, we'll do some practical sort of discussion work around how, what that might look like.
Okay.
Okay. So the time here is, what's the time?
Well, 12 minutes past.
12 minutes past 11. Yep.
Yeah, 10 minutes, 22 minutes past is my math.
That's right.
Good.
Okay.
Great. So we'll just pop the camera off and please feel free to go and get a brew. Yeah.
Hello, is Amanda still there? I can't see her on my screen. Hi, Amanda. I put my details in the comment section. Would appreciate your contact details as well. I'd love to meet you next time I'm down in Bridgewater. Yeah. Great.
Hello, everyone. I hope you all had a chance to grab a cup of tea or other refreshments. And we're just drifting, most of us are drifting back now. Good. Any quick comments or questions before from anybody before we move on to photos going to start the conversation post break? Any questions or Anne Hills?
Hi, and I was just thinking about your compelling information, and I'm thinking back to the example I gave, and the reason I found that compelling and I was drawn to it and I wanted to read the article was it related to me, and I think it's finding information that's compelling for the reader. So thinking about who your audience is and finding anecdotes or stories or information that the reader is going to find compelling.
Yes, yeah, that's a great point, Anne. And one of the and if you can actually have some other some complementary data. So if you find something, for example, in the secondary data, or you find some statistics or something, and if you can then also present a qualitative piece of information, you know, that speaks to people about that particular issue, that's even more compelling, because you've then got, for those people that will only be convinced by a certain type of data, you've got that evidence, and then you've got a testimonial or a quote or something from an interview that really talks to people about the issue that's personal. Then yeah, that can be super compelling. So good point.
And sorry to carry on, but and another thing is people consume data or information in different ways. So some people are figures people, some people are graphical. So if you can introduce pictures or charts, again, that helps build on the evidence so that people are hit by it in all sorts of different directions.
Yeah.
There's no way they can say no to your funding application.
No, that's right. And multiple sort of sensory pathways too. So, you know, pictures or representations of people as they are describing or sitting in the middle of the challenge, that's really compelling as well. But hearing their voice, whether it's a quote or, you know, something like that, if that sits alongside that additional evidence, then that's quite compelling.
Yeah, and videos from the service users or members, you know, videos from the people themselves saying how much this has impacted them is unavoidable data.
Yeah, it is. Andrew. Just having a quick question.
Yes, hello. Yes, I'm finding it very interesting because as we are only a parish and have no councillors, so and a lot of our residents do not do anything online, although we do have a parish email from the clerk. What I'm getting from this is how we can gather our data in the appropriate way about you know, what to put on a survey, what type of things do we need to put on the survey, the questions that we need to ask our residents, and also how are we going to get the feedback back, because not every resident does online. So, and our parish is, although it's small in residents, it's very widespread. So how do we encourage our senior residents to return these forms? What can we do to help them return it? Do we have to put a box in the parish church so they can just go, when they go to the church, can they just put it in a little box and then the clerk can pick it up from there? You know, these sort of things. So it's very interesting, the data, you know, primary and secondary. I think that can give us a direction about what do we need? What does the parish actually need, apart from we do the Christmas carols, a yearly barbecue in the summer, and there's a monthly coffee morning. What else can we give to the residents to come together to minimize that isolation?
Yeah, that's good, Andrew. And you're thinking now, you're really thinking strategically now about what you need to know and how you get to know it. And maybe you could extend that idea about what you were talking about with the questions. So what are the questions we put on the survey? We need to, you know, to that, how do we get it back from them? So you can ask them, what would be the best way for us to get this information from you? Do you want someone to come and sit with you and move through the survey and record what you're saying? Or do you want, do we need to put a box in, as you said, in the parish church? Or what would you need so that we could get this from you, because we value this information? So that could be something also to look at. Ask people how they would like to be able to feed that back. And even asking that question makes them feel immediately more included and engaged. Even if what they say is not possible, at least someone has said to them, what is it we would need to get that from you? So yeah, I think you really are thinking on the right track, absolutely.
Thank you very much.
Did you want to take any more questions?
Did you?
Yeah, I think if we take a few questions, we can run over a little bit.
Yeah, we can. Simon Bellamy. Now, Simon's the compelling case person, aren't you, Simon?
Yeah, well, that 40 years as a civil servant, you come up with these kind of buzzwords, really.
No, it's absolutely right. Yeah.
A simple question, and Fodo might answer this in coming up actually, but is a kind of who does the assessment of our application for grants and things like that? And so
yeah, I think Fodo will.
In that case, it's kind of many of us are councillors here, and can we go when we do our council meetings? We know that somebody who turns up at the meeting and puts forward their case themselves, along with the evidence and stuff that they've gathered and their application for whatever, that's much more convincing, and you can have a two-way conversation about stuff. So maybe Photo will cover this, but is there an opportunity where we may be able to stand and speak in front of our assessors as to, or not?
Photo, do you want to come in there quickly before we go to Amanda?
Yeah, would it be useful for me to cover the bit about the grants before there's any more questions, unless anyone's got something separate to that that just ties to the other information, so I could pick up some of these issues. And also we can support people with community plans. I've done community plans in the past and know some of the pitfalls. And also CCS do a lot, so I can drop that into the chat if someone hasn't already. But I'm also very conscious that it's 11:30, so should we move on to just a little bit about the grant programs, and if people could hold their questions, and they might come out also in the breakout rooms, because we can do the breakout rooms now.
Right, okay, yeah. So I'll go back to the slide deck, and if you just tell me when to move on Photo, I'll just.
Cool. I hope everyone's happy with that. For though most of you will probably have already come across the grants that we have available, and where we've got these broad categories of grants that you might have seen. Number one, they have to be for community health and wellbeing related activities. And number two, they need to come from a council. So that could be a city, town or parish council, not the county council. They can then come from a range of collaborating councils, or a council collaborating with an outside organisation to look at, that they might want to work with. So it's not that we're excluding organisations, it's just that the grants will go to a council. The seed grants are really there to scope out those ideas. So if you've got some thoughts now that you don't have that evidence of need, and you need to do some sort of community review, community survey, then you can come to us. We have just this week granted one to a parish council to carry out a community survey that will have a focus on what people's needs are for community health and wellbeing. We say they're up to £1,500, but that's, you can talk to us if you actually need 1,800, 2,000, but there's still a seed grant, then come to us and talk to us. We don't require any match funding for those either. We want you to try and get hold of this information. It's information gathering. So we've given out a few recently. Small grants go up to £2,500 ish. Obviously, if you need 5,000, the amount of information and evidence we need will not be quite as much as if you go for our full whack grants of £35,000. And the thing I would say, so the absolute max is 35k. You can have one grant. So if you come to us for a small grant, I can't guarantee that you could come back for a large grant anyway. But there is money in the pot at the moment. If you go for a seed grant, you could then follow that through into a larger grant. Don't think that you need to go up to this 35k mark. I think it's almost a stumbling block to have suggested these these kind of funding caps. You know, you could look at 5, 10, 15,000 if that's what you need. If you're a smaller council and you think you can create the longevity, then that's brilliant. But again, we can run, if needed. I'm very happy to run another online session just about the grant program. I'm really happy to do that next week or something if it's needed. So yeah, it's about having a conversation. I've heard lots of interesting ideas for projects. Is there another slide that goes with this one, Hayden? Or was I just talking to that one? Okay, so these are just a few examples of some of the funding applications that have come through. You'll find lots of information. I'm not going to talk through those at the minute. I'd rather we moved on to some scenarios, if that's okay. Did anyone have you asked a question about the process? If it's a large grant, then Jeff and Frederick are here in the room. I would suggest that we probably could invite you in, but what happens is my view is I don't want to waste your time. I will tell you very quickly if I think your proposal is a non-starter. If it's all capital, it's a non-starter. If it's not addressing identified need, then you'd need to go and seek out that need and see if it's genuine, if it's just a thought process. So I will sell it on your behalf then at that point, Frederick, and I will find out if people come into the room who've made those applications to present their argument. But it's more of a case of the assessment panel might have a couple more questions or observations, and so they might just come back to me and I come back to you and we take it from there. I hope that nothing we put forward between you and me to the assessment panel will get outright rejected. That's my plan. So I keep them I'm keeping the assessment panel in the loop a little bit as to what they might see in the future. And I will share the link about the CCS and their advice. There's a lot of advice on their website, Community Council for Somerset, that will talk you through how to carry out a community plan, a community review, a village survey, whatever you want to call it. It's all the same thing. It's not a neighbourhood plan. A neighbourhood plan is very land use based and sits in the local plan framework. But for a community plan, all the sort of things we're looking at, yeah, there's lots of advice on the Community Council for Somerset website, and I'll share a link. Yeah, thank you. I think that's me done, unless anyone's got a question.
I think we've got a few questions.
Ooh. Are they questions from before?
I think Rosa.
Amanda.
There's Bill, I can see is number 1.
Yeah.
And Amanda's number 2.
Yes, please. My question is to Fodo. I'm doing a bus survey which went out 2 weeks ago to see how often people would use a town bus, which I'm proposing to put into place over the next 12 months. And therefore, I'm collecting the evidence now at the moment. But I've self-funded that because there was no funds from anywhere else. Can I retrospectively apply for a seed grant?
Unfortunately, I don't think you can. No.
No, I was afraid of that.
Have you done that through a council?
No, well, sort of. We are a Wales Bus User Group. We're under the umbrella of Somerset Bus Partnership, and although councillors at Wales are supporting the project, they haven't actually taken it over yet.
No, I think that's the problem, is that it would have had to have come from Wales, I'm afraid. But it's maybe there was a yes please in the chat to me doing a session online just about the grant funds. And I
There is,
think
yes.
what I'll do is I will set that up so that we can just stay on track for gathering evidence, if that's okay, during this
Fantastic.
session, because I'm really conscious of the time. So Karen and I will throw out a date, and then hopefully you can all make it, if that's
Great.
if
Thank
that's
you.
doable.
Yeah, and perhaps Bill and Amanda, if it's okay, we can possibly pick up questions at the end. I'm happy to stop on a little bit if the question is about the session. Fodo, if you've got a little bit of time, if it's about grants, maybe we can put that back into a future session. So we've hopefully brought it back to Somerset from the beginning of the presentation. And we've got a few breakout rooms today. Mark's just going to literally go to another breakout room as I introduce the session. So in the first part of today's sessions, we looked at the types of information, qualitative or quantitative, that might be compelling and useful in developing a grant idea. And we also looked at primary or secondary data or evidence. And what we want to do is present 3 scenarios. So we're going to split out into roughly 4 breakout rooms, I think, and you'll have a facilitator in each room. But these questions are what we want to kind of think about. So if we spend approximately 10 minutes, hopefully Karen's on the call once we get into breakout rooms, just to kind of reflect on these 3 questions that relate to a particular scenario. And I'm just going to go to my next screen, which is the different scenarios that we're going to be talking about. So the first one is a seed grant, and you'll see that across all of the scenarios, these are actually youth projects, and hopefully what we can get from each of these examples is also that sense of scale that Fodo talked about. So particularly about a seed grant being a way to test out an idea or a concept or bring evidence together, the small grant for an actual project that involves doing some activities perhaps, or a larger grant that involves a more substantial sum of money to run activities, etc. So for the groups, we've got on the left, we've got a Shepton Mallet Town Council Youth Council grant that was to scope out young people's interest in taking an active role in decision making in Shepton Mallet. And some of you may even have worked on these projects who are on the call. The council will be working with the school and existing youth provision to reach all young people. The second small grant is going to be facilitated by Fodo, and that's about Burnham-on-Sea Town Council, the On Your Bike project, and that was to develop a project on bike maintenance and road safety advice. And the council brought in On Your Bike. They worked with the police and disaffected young people to offer them something constructive to do. And then we're going to split the large grant group, I believe, Fodo, I think I'm right in saying so, into two groups, because we've got quite a few people on the call. So Mark will be one of the facilitators. I think, would it be Frederick or Karen as the other facilitator? And the final, the large grant is a grant to help young people who might be struggling. And this covers all parishes in the LCN. So a collaborative project that provides outreach youth services to those who team up with local schools and organisation. The grant award is around 35k, and it works with the large local councils providing match funding. So hopefully now we should be put into our respective breakout rooms, I believe, and I think Karen's managing that for us. Is that?
I'm managing that.
Oh, right. Sorry.
Okay, just bear with me because I got to do this manually. So
Okay.
you'll be put in a room, and it'll be number 1 will be the seed fund, number 2 will be the small, and number 3 and 4 will both be for the large grants. Which one were you in, Hayden?
I'm group 1. I'm the seed grant.
Seed. Okay, thank you. I have an issue that I can't assign some people, so maybe you're just left.
We can do that. We can go into breakout groups, or we could just have a discussion about the three scenarios.
Have some people gone to rooms?
No, I don't think so.
We could probably have 10.
Okay,
10.
I'm just going to bear with me. I assigned people to rooms, but not everyone was assignable.
Yeah, I'm not sure our Teams is wanting to play ball today. Foda, do you not think in the interest of time that possibly we should just discuss the three scenarios?
Yeah, I'll share my slides again.
Yeah,
I agree.
Apologies for that.
Right, here we go. Okay, are those being shared? Yes.
Yes.
Great. So yeah, basically we had hoped we were going to do different breakout groups, but unfortunately Teams has played the role with the ghosts again, which is not unfamiliar for me, particularly as I'm a bit of a technophobe as well. So if we could possibly bring some ideas together, and I realise there's a couple of people with their hands up. If you want to kind of also shape some of your questions around some of these projects, that's fine as well. So first, just to recap, the main projects questions were to first of all consider what types of information, quantitative or qualitative, which you have heard Mark speak about earlier, do you think would be useful in developing a seed grant? So I'm going to open the question. So the seed grant for this is that project that was Shepton Mallet Town, and it was looking at scoping people's interest in taking an active role in decision making in Shepton Mallet. Could you, drawing on the first part of our session, would somebody like to volunteer to start things off? Amanda, I think you've got your hand up. I don't know if that's historic.
You're on mute, Amanda. Unmute yourself.
I think people have forgotten they've got to put their hand back down on the system once they've spoken.
Amanda's speaking. Amanda, you're on mute.
Can't hear you.
Don't think. Can we unmute?
Maybe. Here we are. Am I on?
You're on. You're on.
Yeah. None of these are relevant really to older people, and that's really why I'm here, because we don't really have a youth problem in this village, and it's very small, and I think it was Andrew who was speaking, and I thought, well, what I would do with older people is go and knock on their doors and contact. I deliver the village magazine, and I get talking to people. I've found that it's often applying for attendance allowance, and I've sort of put that into place, and that really older people, most of them, just can't do the internet. They need help with technology and forms and GPs. So this is not going to get me anywhere. Sorry.
So Amanda, what I think matters is basically how you would go about scoping out people's ideas. And as you rightly pointed out, that does probably look different for different populations. So I think some of what you said is really valid, and it does apply both to youth projects and to older people, because it's about finding the most appropriate way of using some of those sources of information that we talked about earlier. So I think actually what you've done is raised, albeit on a tangent, quite an interesting issue about how you collect data from different populations.
Yeah, I find that delivering the magazine's fabulous and catch up with people. I've heard helped but a couple of people with forms and so on, and that's basically how I would do it through the council because I'm a parish councillor, and they are interested in helping a lot of people, in helping people who can't get outside their homes very easily and are struggling with things like Slinky Bus and all that sort of stuff.
Yeah, so I think that is a really valid point. And I think if we think back earlier to the example of graffiti, there are different creative ways, there are different ways we can build that connection with people. And that links, especially for me, to qualitative data. So what you actually might be doing on the doorstep is effectively interviewing these people. It might not feel like an interview, but you're gathering their perspectives through a discussion. And I think in the same way, perspectives have been gathered through the project that used graffiti art to get people's views.
Rosa, next.
Rosa, would you?
Yes, I just want to say in the Shepton Mallet thing, that project that you've spoken about, where you're trying to contact young people, youth clubs, if they exist, cinema, cafes, get information in those areas where you would catch the younger people. Football clubs, of course, rugby clubs, that kind, where young people gather, and obviously interview them to what aim of your project is. What I've done here in Wales is done an A4 sheet of tick and circle type of responses, and I've put boxes in 2 separate churches, the library, and we're very lucky in the town hall, so people can drop their response in that letterbox, as well as an email at the bottom of the survey where the people who wanted to and could access the internet could return that by email. That's the best way I found it of doing it here in Wales for the little project I'm doing for a local bus. However, it's very difficult to contact people unless you have lots of volunteer helpers with you, because there's a lot of road and a lot of houses to get to collect the information that's needed. So that's the problem I have here, is because I'm trying to collect information from the rural areas. I can't get there unless I got a driver to take me into that particular village.
So that sounds like largely qualitative and primary data, and the collection methods, you're yet to land on something that's going to be successful there. Yep. So that's the qualitative primary data, and possibly through interviews or other places where people gather.
Yeah.
Thank you, Rosa.
And I think some of that place-based approach can be also useful. To give an example, Amanda, I worked a few years ago on a project to do with rural and social isolation in people aged 50 and over, and actually the importance of delivering a questionnaire, which was quite a marathon to put people through remotely. We actually felt that it was better, and the company that wanted to do the evaluation actually recognised that the people who were delivering projects were the people who would be trusted to do the survey. So even if we're looking to collect some of that quant data, some of those stats about people, we can still use similar engagement approaches that even Rosa has just flagged up. I think Andrew, Andrew, would you like to?
Hi. Yes, I'd just like to point out one of the problems is finance, because we are a parish and we receive no precepts at all. Okay, so we have to be very mindful about any money that is raised through our events, like I said about the carols, barbecue, the monthly coffee mornings and the harvest festival and such things. So we have to be mindful about where we spend our money that is locally raised. And at the moment, I go walking through the village every day, through the footpaths, bump into people walking their dogs, have a chat. So, you know, we do things like that, but also we've put out a survey as well, because as the flooding is so bad here, we're looking to the Somerset Rivers Authority for a grant to help with minimise flood resilience, with pumping facilities, supporting and supporting the residents that way. So we do try and do things as best as we can, but it's the constraints of finance is the biggest problem with a parish that doesn't receive a precept. Yeah. And there is an ongoing feeling in the future, which I must say, our ward councillors for Curry Rival and Langport have given support and decided that the next best forward would be to join with a parish council that is on our boundary. And that, I think, with money being very tight on everything, it's something that the village, although it doesn't want to do because it's proud of what it is, but actually to get things done, it's going to have to be a way forward for the future. So, you know, we do try and do everything we can with a limited budget, but it's trying to go the right way about, like I said, about getting this data and everything else like that, so we know which way forward the parish can move forward for the future. Thank you.
So I think you could actually think about the seed grant in that perspective, and that actually the seed grant is about getting some of those perspectives together, doing some of that data collection, and I think Fodo's also put some links up in the chat as well that could possibly help with that process. So if we're still focusing on the small grant, the seed grant, sorry, that's somewhere where you can test out a concept. You can probably work with one of Fodo's sessions where she could hopefully do some feedback on how that seed grant could be the idea, the testing out of an idea in your local community, but also developing that initial evidence base so that you can then go on to something a bit bigger, really.
And flooding is a big thing, Andrew. Flooding is a hot topic at the moment. So you've already mentioned some types of data. So quantitative data, you could actually have data from that Somerset organisation that you talked about that's involved in flooding. You could ask them for some, as local as you can get, statistics there. So that would be secondary data that they're giving you, secondary quantitative data. And you could also ask people on the streets the impact, or the other thing that is a really big thing at the moment is flooding anxiety. So how vulnerable people feel about flooding, how it makes them, anxious. Those sorts of things would be some qualitative primary data that you could collect, which against those statistics, if they were also supporting the flood risk type scenario in your area, would be useful. And if you did get some seed funding, then the data collection could be funded you could have someone who could do, have time to do that sort of work. So that would be a very nice little scenario where you could get some really good evidence there, just to say, is flooding actually an issue for our community? And if it is, tick, then you can move on to the next stage, which is we need to do something about that. So yeah, that could be a way to do it, because there will be data that is collected by others that you could access, I'm sure.
And at the end of the slide pack, we won't show the slides at the end today, but I've put some resources there that include some connections to some secondary data sources that might also be useful for people who are drawing on some of those published reports, and some links to the Somerset Intelligent Hub as well, that contains quite a range of demographic, population data, etc.
Can I just have a really quick interject? We can add to that. I'm aware of what links are in there, but we can add to that this link to the Community Council of Somerset and Somerset Rivers Authority, and there are grants available at the moment also for flood, specifically around flooding, and Bell Deering does offer cafes for people who've been affected by flooding, who've have become anxious about it. So not just solutions to flooding. So again, it's back to, if you've got a specific idea and you want to think about how you might work that one through, do have a conversation with me, because I've been making contacts with lots and lots of different people locally, and I can point you in the right direction. Jeff's just shared, I think, Somerset Prepared information. So there's lots of information out there. I think I agree with what Hayden's saying and what others are saying. It's different approaches to different people in terms of how you might gather the evidence on the ground. So if you're dealing with older people, you're probably not going to do an online survey. No. It's not going to be your primary way of gathering information, but you might think about, is there a Saturday market? Is there a place that people congregate? Do you have a village agent? Do you have talking cafes? And when you're talking about young people, you can do an online survey. And if you work with your school and get it out, we did that, and Pauline can attest to this. We did that for our community survey, and we had 157 replies because we just did an online survey for young people using Microsoft Forms. They've all got access to a smartphone or a computer. It took 7 minutes to complete. We worked with the school as how to word the questions and how many questions, and we got 156 responses, which is probably all the 11 to 16-year-olds in our parish, if not more. So
Sorry, Mark, just going on a bit there, but I must say we are having a parish meeting on Monday with our ward councillor in respect of the SRA grants for flooding. So we've already put out paper, a letter drop, as well as an email to all the residents in the parish for feedback for that. With our clerk, we've drawn up a flood plan that can be presented to the SRA. So we're already in that process of doing that. We've done that by ourselves, through the LCN at the last meeting, that the SRA, the Internal Drainage Board, and the EA were there. So we're already taking care of that part. But this is more about the isolation and the vulnerability of our senior residents. Thanks very much.
That's great. I'm just really conscious that we've already gone over time, and there's lots of people that want to ask some questions. So sorry, thanks.
Yeah, I think if we probably park some of the scenarios, but keep those in mind, but probably focus on the Q&A if that's going to be useful for more people than going through the scenarios. So Anne, we've got, Pauline first.
Yeah, very briefly, about the primary and secondary data, and I very strongly feel that the secondary data is really useful as a sort of an underpinning. So what do we already know from various sources, and it can be like, say, census data for the youth thing. So what is your proportion? What is your population of young people in your area, for example? So then you know if you've actually got a sort of representative response in whichever method you use. But also, I'm a great fan of using other people's, looking at other people's work, what's already been done. So in this aspect, looking at the work that Teresa has done with her youth groups around graffiti, and learning lessons from that. So there's already some excellent work that has been done that we can use to learn from. So that's it. I'll shut up now.
And Anne Hills.
Oh yeah, thanks. I'm just echoing quite a lot of what Fodo has said and what Amanda said previously. And again, yes, I'm going back to my idea of it depends on your audience. Who do you want to gather your data from. So adapting your data collection to the people that you want to gather the data from, and having different methods for your different audiences, and making it fun. You know, filling out a survey is a bit boring, so you find, you know, dots on a map, or you know, leaves on a tree, or you know, any way that you can get of gathering data that is not typing text into a box, because also you have to bear in mind some people don't have those literacy skills. So you know, a filling out a form is incredibly daunting, and you just won't gather data from those people. So talking to people where you're filling out the form, but with their responses, reflecting their responses, is so much better than asking them to fill out a form.
Yeah, great.
Are there any other thoughts or perspectives? Oh, Simon, sorry. Yes.
Yep. Just I made some notes as we were going through this, and so it's a bit going back a bit really, but just what did I write? Yeah, thoughts on building our cases. When gathering evidence and building our cases, we perhaps could consider what the answers might be to the problem. In other words, we need to do our research properly. And for example, the transport the answer might be a slinky bus, but then we need to assess that and sort of say, actually, this is how the slinky bus falls short of what our requirements are. So there would be many cases where we don't know what we don't know, and the answers might be there, but they might still fall short, and for various reasons, depends what your cases you're looking for. For a small action anyway, and then also consider the consequences of no action when you're building your case. So what happens if you didn't get support like this? That can make things a bit more compelling. Yeah. But that's kind of it's a subjective thing, because you don't actually know what could happen, but yeah, that kind of thing. And also, no action might be the right thing to do. Are we as councils trying to find a solution to something that doesn't really prominently exist in the priority of things that our councils have to deal with at the moment? We need to weigh and balance that and understand that might be the case. There might be a smaller thing, or that there are people in the community like village agents that might be able to address the situation itself. That's it.
Excellent point, Simon. And just to link your comments to Pauline's, so Pauline is saying don't reinvent the wheel. There's evidence out there, so find it and use it. But you're suggesting that there might be gaps there. And so the gaps, you know, what is not known, that might be that might be the space in which you might want to do a bit of work to fill that gap and then complete the evidence around that particular question. So surveying the secondary sort of data types and saying, this is what we know, but the important things that we don't know are this, that, and the other. We either need more information before we can act, or we have sufficient information to say, actually, this is not really a problem. Because I think you're right. I think some people come with solutions and sell you solutions that actually there is no problem for them to solve. And so establishing the evidence, what is it? What does it look like? How complete is it? And do we need to do some more work? That's a really strong way to approach it. Yeah, absolutely. But caution, Pauline, don't just rely on secondary data, because it might have been collected in a completely different context. And we see, you know, we see interventions and we see issues that are identified in one community. We see it particularly in urban versus rural. We see a difference there. And then a solution is plonked down in the middle of the rural community. It doesn't work. And yet we say, what went wrong? It worked for this community, and it's because we didn't do that contextual stuff. So that's really important, is to say, does this context that we've got this evidence from, does this community look like ours? And if not, how is it different, and how might that impact the way we could use this intervention, which has been successful somewhere else? So the Slinky bus, even though I know nothing about Slinky buses, it could work really well in one area, but not well in the other. And so it's identifying what is the difference in the context. Yeah. So some really excellent points, Pauline and Simon. And Anne, thank you.
Yeah, Anne, I noticed you've got your virtual hand up. I'm not sure if that is a historic virtual hand, or would you want it to just say something else?
Legacy hand. I think the term's legacy hand. Sorry.
Legacy. Heritage hand, yeah. We call it.
So I think we've kind of had quite a really useful discussion today. Really interesting to get some of the common themes that have come out of the issues that are in your community, and hopefully the discussion on the different types of data, primary and secondary data, and how we can use this to create a compelling case has been useful. What I should say, just to kind of wrap things up, is that we wanted to let you know that we're going to be coming down to Somerset for 3 days, hopefully in March, isn't it, Mark?
Yep.
And we will be there if you want to come and join a drop-in, if you want to bring your grant idea, we will be there, and we can help talk through some of your ideas for a particular project. It might be that you have an idea for a seed grant, and we can talk you through those different ways of how you might want to use data. But mainly it will also be a social opportunity, because I know that teams can be a bit clunky at times. So it would be great if you could join us. My email is on the slide deck that will be distributed, and please feel free to make contact with me if you've got any ideas or things that you think we can help support you with to help grow your grant ideas. I think we just have a question from Phil, don't we?
Yeah, it's just a quick one. If you guys are coming down in March, I just want to clarify with Fordo if there's a time scale on the availability of these grants, or whether they're just running on.
Okay, well, I had my hand up to say something again as well. Is it possible to lose the slide so I can see people again? Thanks, Hayden. Okay, so well, there is a time frame. The time frame is that this grant program will end at the end of June 2026, which sounds like it's a long way away, but actually in reality it's going to be a case of, if you will need feedback. So part of these sessions are not only to help you gather evidence to present the need to get the funding, but how are you going to gather the evidence to monitor the success or elements of lack of success of your project, which is equally fine, but it will help, something goes wrong helps you move forward. So you will need to, we are probably saying that projects need to end by the end of April, particularly for large grants, or probably the end of March, sorry. So look financial year, and then by the end of April for small grants to give a month to feedback. So if you want a large grant, you need to be getting that large grant application to us. If you're thinking it's a year, if it's a one-off event, like a festival or something for your community, then obviously you can apply later. But if you want them for the full financial year, you need your applications in by February, which is why I've been, hanging on about this, and everyone's bored senseless of seeing me and hearing me ram this down their throats. But February, you need to be getting those applications to us, so that I can go through them. It goes to the assessment team. They can come back with any other questions. We can get the money into your bank accounts once they're approved by the beginning of your next financial year. So that's, if you're looking at a seed grant to give you the evidence for a large grant, then you need to factor in that time frame. I go on leave on the 19th of December, and I don't come back until the 2nd of December. And I'm guessing that most people, 2nd of January, and I'm guessing most of the team that would assess will be away over Christmas. So if you've got an idea for a seed grant, do have a conversation with me ASAP and get those applications rolling in. The money is there. We turn them around pretty quickly, and you will get you'll get your response really, really quickly. What we're going to suggest is, you may have picked up in our newsletter that, and Karen's just shared a link to that, it is that we're going to be running drop-in sessions where people are coming in to talk about other grants and grants they've received from us. So the first one of those is on Wednesday at 6 p.m, looking at the grant programme and warm spaces and grants that you can access, that Spark Somerset will know more about, and they're coming along. So what we're going to propose is that we could stay on after that for anybody who has any grant related questions. And the following week, what we'll do is we'll start at 5 p.m. and do an hour just about the grant programme, and we can pick up any of this gathering evidence stuff. So some of you may know I'm a town councillor in Wiveliscombe as well, and I helped lead on the community plan for Wiveliscombe 2 years ago, and I chair the community plan group in Wiveliscombe. And also I'm an ex-planner for my sins. I don't really tell people about that because it's, yeah, I used to be a planning enforcement officer, so nobody wants to hear that, do they? Miserable job. But anyway, I have got a bit of background in gathering evidence and presenting it and things like that as well, and understand town councils and the slow movement of town councils and parish councils. So the other thing that you do really need to note is anything you propose needs a minuted evidence that your parish, town council, city council approve of the application. So you need to get a motion to your next meeting, even for a seed grant. You need them to say, yep, we support this. That's real key. And if anybody wants to set up any meetings with me, I will try between now and when I go on leave, but I'm pretty booked up. But do get in touch and try. I've got a bit of free time on Wednesday next week during the day. And like I say, I'm happy to stay on at the end of the teams. So join us for the warm spaces bit, and then I'll stay on for anybody else. Does that help? And 5 p.m. on the 18th, I'll do an hour, and we'll send that out to everybody in this meeting. Karen's making notes, I hope. Thanks, Karen.
And I think we've also got a virtual drop-in. We'll probably run a few of those as well, just for those who can't make the place-based stuff that we have in the new year. But I thank you for being with us on this training session. I hope you find it useful, and I think everybody now could have a well-deserved cup of tea. Okay. Thank you very much, everyone.
Thank you, everyone, for coming. I hope it was useful. Do follow us up.
Yes,
Get your grant applications in. Everything's on the website. Take care.
Bye.